Now, the major takeaway that I want you to get from this is understanding that the stress, the trauma that a person experiences doesn't necessarily need to be horrific. It very often is, but it doesn't necessarily need to be being a participant in a war, being the victim of a rape, being the victim of a violent crime. Many people, particularly people who suffer from substance abuse disorders, experience trauma in more subtle ways, whether it's chronic neglect in their childhood, emotional abuse. So the key finding, the key feeling that people who suffer from PTSD have is that they at some point in their life felt profoundly helpless and unsafe in the world. And that feeling of helplessness and being unsafe profoundly influences how they operate in the world. There are three key things, three key diagnostic criteria that people who suffer from PTSD have. Typically, would they live in a place where they are constantly avoiding either emotional connection with other people, places, people who feel unsafe to them. They re-experience the traumatic events frequently, either through nightmares, horrible nightmares, or flashbacks where they are pulled back to the experience where they felt helpless and unsafe. And they become hypervigilant in the world, meaning that they exist in a world which feels fundamentally unsafe, where they feel like they constantly need to be on guard, where people are a threat, situations are a threat. They are always looking for that proverbial shoe to drop. So those are the traditional characteristics that people who suffer from PTSD need to endure. Uh, the good news here is that there are very effective treatments to help a person recover from PTSD. Typically, they involve working in a relationship with a therapist to deprocess the trauma, to unfold the traumatic event, and so that it's laid out in front of them in a way that isn't threatening, where they can put it in a frame that feels more contained. Specifically, the specific modalities that are used to treat PTSD effectively are EMDR, which is a form of reprocessing trauma, CBT therapy, which is cognitive behavioral therapy. So again, you use your cognition, your thought process, to really explore in a very safe way your place in the world and your inherent sense of safety and well-being in the world. So if you think you suffer from PTSD, look for those three criteria, and if you find that yes, indeed you do meet those criteria, make sure that you utilize one of the very effective tools for diminishing its impact on your life.